So I know we touched on play therapy in our first week, but now we will delve a little deeper into the process of how we may counsel children and adolescents with play therapy. Once again, the question we ask is, what is play therapy? Play therapy is a counseling approach that uses play, the natural language of children, as the main way to help them express feelings, work through problems, and build coping skills. Instead of relying only on talking, which kids may struggle with, play therapy lets children show their thoughts and emotions through toys, art, games, and imagination. Let's do a quick overview of the history. Some of the earlier roots consider the idea that play could help children heal goes back to the early 1900s. Freud and his followers recognized that children might not articulate feelings directly but could reveal them through play. Two pioneers of play therapy involved Anna Freud and Melanie Klein. They expanded this idea, with Klein focusing on analyzing children's play as symbolic of unconscious thoughts, while Anna Freud stressed the importance of both play and the therapeutic relationship. By the mid-20th century, Carl Rogers and Virginia Axline brought in a humanistic twist, believing kids have inner strengths that can grow in the right supportive environment. Axline is especially famous for developing non-directive play therapy, sometimes called child-centered play therapy. Over time, play therapy demonstrated modern growth. It branched into many approaches: psychodynamic, cognitive behavioral, humanistic, as well as others. Professional organizations such as the Association for Play Therapy, APT, have helped standardize training and practice. So what is the status of play therapy today? It is a technique that's widely used. Play therapy is now a common intervention for children experiencing anxiety, trauma, abuse, grief, social difficulties, or developmental challenges. Evidence-based. Research shows it can reduce emotional and behavioral problems, build resilience, and strengthen parent-child relationships. While more rigorous studies are always needed, there's solid support for its effectiveness. When looking at play and development, we must understand the intrinsic value of play therapy. Play therapy isn't just fun time in the counseling office. It has deep, built-in intrinsic value for children's emotional and developmental growth. Researchers have shown several ways in which play therapy serves kids beyond the surface level of toys and games. First, how do we help master difficult emotional realities? According to Factor in 2009 and Smith in 2010, children often face experiences that feel overwhelming, like family conflict, loss, trauma, or fear. Through play, they can rehearse or try out ways of coping, gaining a sense of mastery and control over situations that might otherwise feel unmanageable. Example: a child who felt helpless during a hospital stay might use dolls to play out a scene where they are the doctor, taking charge of what happens. Secondly, Slade believed that expressing internal experiences. Kids don't always have the words to explain what's going on inside. Play provides a safe language for them to express thoughts, feelings, and fears that are difficult to verbalize. Example: a child who can't say, "I'm scared of my parents fighting," might instead make toy figures argue loudly, showing the therapist what it feels like at home. Now we'll review the dynamics of child-centered play therapy. For the overview, we can see how child-centered play therapy, or CCPT, is based on the idea that children heal, grow, and make sense of their world through play, just as adults do through talk. The therapist's role is not to direct or fix the child, but to provide a safe, accepting space where the child leads the process. This approach stems from Carl Rogers' person-centered therapy, emphasizing empathy, unconditional positive regard, and authenticity. Some of the core principles of CCPT. The child leads. Children naturally move toward growth and healing if given the freedom to express themselves. The therapist follows the child's play themes rather than imposing structure. Play as communication. Young children may not have the words to describe complex feelings, but they can speak through play, using toys, stories, and symbols. Play allows expression of fear, anger, sadness, and hope in less threatening ways. Therapist role. Provide unconditional acceptance. You are valued just as you are. Offer empathic understanding, reflecting what the child expresses verbally or symbolically. Set consistent boundaries. Safety and respect are always maintained. Application with young children. Why does this type of therapy work? Young children often lack the vocabulary and cognitive maturity to articulate inner experiences. Play gives them a natural language. Example: a preschooler who experienced conflict at home may reenact arguments with dolls or build a safe house with blocks. The therapist doesn't correct or interpret, but reflects. The dolls are fighting, and that seems really important to show me. Developmental focus. Expression of raw emotions, development of self-concept, mastery over fears, and exploration of safe relationships. Application with adolescents. Why it works differently. Adolescents may have more verbal skills, but play and creative expression can still lower defenses, and CCPT and Rogers' person-centered theory, child-centered play therapy is essentially Rogers' theory applied to children through the medium of play. Rogers' 19 propositions explain how personality develops and how behavior reflects our attempt to meet needs and stay true to our self-concept. In CCPT, the therapist applies these principles by trusting that children, when provided with the right environment, will naturally move toward growth, integration, and healing. Key links between Rogers' theory and CCPT. Behavior is goal-directed. Rogers believed behavior reflects the person's attempts to meet needs or actualize themselves, even if the behavior looks problematic on the surface. In CCPT, play behavior is understood as purposeful. Every doll fight, sand tray creation, or superhero battle has meaning tied to the child's goals, e.g., working through fear, finding safety, expressing anger. The therapist does not label the play as bad or nonsense, but sees it as part of the child's growth process. Experiences are denied, distorted, ignored, or integrated. Rogers argued that when experiences don't fit a person's self-concept, or when they're too threatening, they may be denied, distorted, or ignored. Only when the environment is safe enough can experiences be integrated. In CCPT, a child might first distort painful experiences in play, e.g., the monster ate my family, instead of directly showing abuse. Over time, with unconditional acceptance, those experiences can become integrated into the child's sense of self. Bad things happen, but I am still worthy. The therapist's job. Create a safe, accepting atmosphere so the child doesn't need to deny or distort, but can gradually bring experiences into awareness and integrate them. In the absence of threat, experiences are integrated into the self-structure. Rogers highlighted that safety is key. When people don't feel judged or threatened, they can allow new experiences to reshape their self-concept. In CCPT, the playroom becomes that non-threatening space. Through unconditional child-centered play therapy through Rogers' key concepts. First, we have organismic valuing process. Rogers said humans have an internal compass, an organismic valuing process that helps us sense what feels good, healthy, and growth promoting. In CCPT, the therapist trusts that children's play choices reflect this inner compass. An example may be a child repeatedly building a safe house in play, which suggests they are moving towards safety and mastery. The therapist doesn't redirect or fix the play because the child already knows deep down what is healing. Then you have actualizing tendencies. This is Rogers' idea that all people have a natural drive toward growth, wholeness, and fulfillment. CCPT assumes that even when children show disruptive or confusing behaviors, those actions are attempts to move toward growth. This example is where one demonstrates an angry outburst in the playroom, actually to be an attempt to reclaim power or test safety. The therapist provides an environment where this natural growth tendency can flourish. The third area is self-structure. This is how we see and understand ourselves, shaped by our experiences. For children, this self-concept is still developing, and play therapy provides a space to explore roles, strengths, and emotions. Let's look at this example. You have a child playing doctor or superhero who may be trying on new aspects of self. The therapist reflects the child's feelings and themes, helping the self-structure become more coherent and flexible. The fourth area would be introjected values. Sometimes children absorb, introject, the values or judgments of parents, teachers, or culture, even if those values don't fit their true selves. For example, a child who has heard big boys don't cry may hide sadness in favor of toughness. So in CCPT, when the therapist accepts all emotions without judgment, the child can experiment with expressing feelings that have been hidden, challenging those introjected values. The fifth is conditions of worth. Rogers argued that when love or approval is given, according to Carl Rogers in 1957, certain conditions must be present in the therapeutic relationship for meaningful growth and change to occur. These are not techniques, but relational qualities that create an atmosphere where clients feel safe enough to explore, integrate, and grow. First, psychological contact. At least two people must be engaged in some kind of relationship, counselor and client. This isn't just being in the same room. It's a real connection where the client can respond to the counselor's presence. Example, a teen sits silently at first, but still senses the counselor's presence and begins to interact non-verbally with toys or posture. That's psychological contact. It's a start. Second, client experiences incongruence. Incongruence equals mismatch between what the client is experiencing and how they see themselves. This often shows up as anxiety, shame, or distress. Example, a child says, "I'm fine," but their playthings show fear or sadness. They're experiencing incongruence between their felt sense and self-concept. Third, counselor is congruent. Congruence means the counselor is genuine and authentic in the relationship, not hiding behind a therapist's mask. Example, if a child's story touches the counselor deeply, the counselor might gently reflect, I notice I feel sad as I hear that. This models honesty and authenticity. Fourth, unconditional positive regard, UPR. The counselor values the client without judgment or conditions. It's the deep stance of you are worthy, no matter what you say, do, or feel. Example, a child smashes toys in anger and the counselor calmly reflects, you're really showing me how strong your feelings are, rather than scolding. Fifth, empathic understanding. The counselor actively tries to enter the client's world and reflect it back in a way the client can feel understood. Example, to a teen who says, nobody gets me, the counselor might respond, it sounds like you feel completely alone, like no one could possibly I will stop here for Chapter 4. Please remember to complete the assignment for this week and begin reading Chapter 5. Have a great week.